All right, we are back with another clinical conversation. We are talking about CSM, all things CSM, and in this session, we're talking about if you're going there to learn things, to take courses, learn about other continuing education companies, etc. This is your opportunity to have a game plan. So I'm going to start with Ashley. Ashley, you are our Director of Clinical Excellence. If I'm going there to learn, what's my strategy?
Like I said in the other call, there's so much information spanning across different topics. So if there's a particular topic, orthopedics, pediatrics, whatever it is, go ahead and plan to invest time in researching what courses are offered, because you'll find you can't go in 10 minutes and pick and choose. You got to read through it all. Another just personal thought here is going in for most of the courses, not all of them, but recognize you're getting kind of like an appetizer, a sampler, right? They're not super long in length, but you also get to hear from some of the biggest names and experts in our field. So have fun with it. Look for new topics that interest you, and it's also a good opportunity if you can, and you're a nerd like Alex. Hang around at the end. It's pretty easy to end up connecting with the person who is presenting. And again, those connections turn into potentially, follow up in a future. So take your time looking through, let it spark your interest, maybe new pathways, right? For me personally, I'm really interested right now for very little known reason, but respiration. So like proper breathing and training in the outpatient world. So plenty of topics to go and see, does it open doors, and I want to go further with it. So that's my recommendation.
Also prioritize because some are not offered virtual and some are. So there's like on-demand ones that you can see afterwards, after conference, and there's some that are only offered live. So if you're in between two courses that are both at 1 o'clock and one is offered on demand and one is not, then go to the one that's not, and then circle back to the one on demand when you get home.
Alex, what about the app? Courses? Do you think it makes sense to download the app before you go?
100%.
Yeah.
Yeah, you need the app. It has all the courses listed, and you can build your own agenda there, so it keeps you organized.
Jamie, you had a question?
Yeah, dude, are you able to get credit from these classes and courses? Okay.
Yeah, they're normally like 0.1, maybe 0.1 hour.
Okay.
Okay, so we're talking about like the courses that you can take while there, which is good. And there's a lot to take away there. Let's quickly talk about there's educational organizations, and I'm not talking like schools. I'm talking like, for example, Ashley is the director of our Cora Institute for Clinical Excellence. He will be there talking about his courses, certifications. What's the approach there? What do I go in? What mindset do I have going into those conversations?
Yeah, no, that's a great point. I think depending on what your intention is, whether it's looking for a job or what, keep that in mind that a lot of companies, if they don't have something in house like we do, and if that's the case, see if you can talk to the person that's in charge of the continuing education or residency program or certifications. Who do they utilize? Maybe it's an outside company. So certainly make that a part of your questionnaire here. If you're looking for companies and benefits, where do they pull their CEs from? And then you've got outside vendors like EIM is a big one that's there, and typically you'll have some of their top name instructors there to connect and chat. I certainly nerded out on some of my kind of PT idols that were hanging out there. So 100%, find out what they have to offer. And again, when we're looking at whether it's courses, certifications, residency, my personal viewpoint bias to like an outpatient field is, in today's world, we have pretty clear evidence, right? So our clinical practice guidelines, the best combination of evidence of what is the best practice in physical therapy, and see particularly for your, if you're new into outpatient, whether that's new out of school or going that route, find out what are the foundational courses that will make you successful in being your outpatient, your neuro, your inpatient, whatever it is. What is the evidence support regarding training for best practices? Because that's the key to empowerment, independence, and confidence as a clinician. So.
I think that's a great point, Ashley, because I think we graduate and we want to do all the fancy courses. Like everyone wants to be dry needle certified, Graston certified. But when you come out of school and you're going into practice, you really don't necessarily know what you're doing 100%. And so you really need that foundation, that clinical foundation, before you even should be considering like the fancy extras. I think.
Yes, and from an outpatient standpoint, good orthopedic manual courses, anything around foundations in exercise, that can be a weak point in our profession, and it certainly shouldn't be. There's plenty there for functional movements, different ways to analyze, and then obviously pain science, and typically Adrian from EIM is there, but those are kind of like, from an outpatient perspective, key areas to find a path that you can go down, because it just makes it fun.
Yeah, having a strong foundation will help you be less overwhelmed in the clinic. Well, but also there's sorry, Adam, real quick. There's if you're not great on exercise prescription, there's always like group exercise classes offered at 6 a.m. For the therapist. I know I've been wanting to, but I can't. Like yoga, for example, they'll offer, and it may increase your ability to prescribe things that help with whatever flexibility or respiration. So take a course, an exercise course.
Actually, I was going to ask if our friend Dr. Ken Cooper was going to be attending. Shout out to Ken.
Yes, yeah, he's awesome. That's a great question. I'll text him and find out.
All right, well, keep an eye out for him if you are attending. Okay, I think that's all we have time for. Any final advice for folks that are going there with the intention of learning and learning about opportunities to learn in the future?
If anyone didn't have any specific questions addressed, I'm sure it wouldn't be that challenging to reach out or find Jamie Garcia for, like this is the guy. If you're looking for jobs, I would find him and ask that specific question. So.
And if you're looking for a technique, find Ashley, because he'll demonstrate it for you.
Yeah. If you have any questions at all, stop at the Cora booth. Does anybody know the Cora booth number off the top of your head?
16 something.
We'll be in trouble, but you'll find us. We're right behind the APTA booths. So stop by and say hello. These 3 fine people will be there and ready to answer questions. So thank you again for listening in. Thank you guys for all your contributions, and we'll see you on the next session.